Give us a sense. How has the pandemic impacted healthcare in the state of Arizona?
Well, the first answer is severely, significantly. As an industry, the healthcare industry took took a hard hit. When you think about the number of hospitalizations and the number of deaths, it's been a severe blow. But the industry figures out how to bounce back and adjust, and I think that for the most part we have. We did not have to go to crisis standards of care recently in the hospitals during this most recent surge in January, which was a good sign that we kind of weathered the storm with the hospital resources that we had.
I understand that the system was able to adapt, but and you couldn't have prepared for this crisis. But were there any areas that said, "Hey, we should have been doing that all along," or we were somewhat prepared?
Sure. Well, telemedicine is the big one. Uh, in Arizona, we were pretty far down the road of saying, hey, telemedicine is a good thing. Let's encourage it. Our access program had already set forth new rules that said we want to cover telemedicine in all these different situations. And then the community came around and the health plans said the same thing and said, what we do, we want to encourage telemedicine. So that's one thing where we were kind of prepared and we did well. Some groups weren't prepared for that and they had to struggle to create their telemedicine platform for their patients so that they can connect better. But overall, I think the industry was prepared for that.
With regard to telemedicine, how did that affect the elderly or people living in poverty? Were they able to come up to those standards when needed?
Well, I think in some cases there was help. There are pockets of places where people got help, but for the most part, I think that down in the poverty level is where we struggle. And that's a theme that goes right along the whole spectrum of healthcare when we talk about the ACA and open enrollment now, and what's happening with this crisis and the disparities that we see. To me, it's about poverty. And when you have a significant number of your patients or your community that live in poverty, you're going to find this that people are going to not be served. They're not going to have the resources to engage in telemedicine.
You mentioned the Affordable Care Act. The enrollment has been extended. How do you see that rolling out here in the state of Arizona over the next few months?
Well, it depends on how much traction we get with the media and with healthcare.gov promoting the fact that this is available. I think it really depends also on people's willingness to go in and see if they maybe qualify for some help. I think there's a lot of disinformation and misinformation about the ACA. So if people need to know that if they make less than 400% of the federal poverty level, which is for a family of four about $100,000 a year, for one person about $50,000 a year. If you make less than that, then you should go to healthcare.gov and check it out and see where you come in. And you might be surprised that the federal government will help you buy insurance. There's no plan that you have to take. The federal government helps people buy insurance, and you buy it from the regular market, from Blue Cross and United and Cigna and a few others, Centene, Bright Health, and a new one called Oscar. They're all out there willing to sell insurance with a federal subsidy to folks that are uninsured and make less than those numbers we quoted earlier.
And given that the pandemic continues, the uncertainty remains for people who are watching this and worry that they may not be covered in the event of the worst case scenario. You're saying the government is providing an option for them.
Absolutely. And this is what we call a special enrollment period. So they've even relaxed the paperwork that people have to go through to say, hey, look, why do I need insurance right now? You just have to declare that you are unemployed or your earning is such, and and go through the process, and you may qualify for assistance. And we think the Kaiser Foundation thinks that over 250,000 people are eligible for access, which costs them really nothing out of pocket. And those are folks that make less than 133% of federal poverty, which is around $27,000 a year.
For the skeptics who continue to question the ACA and how it's been manifesting throughout the healthcare system over the last few years, what do you say to them?
Well, I would say that there are 153,000 people in Arizona that think it's important, and they used the healthcare.gov to buy themselves insurance and get some help from the federal government. And they're now no longer uninsured. So we helped those 154,000 people. And then there's the Medicaid expansion, which is probably closer to a half a million people now that have benefited from the Medicaid expansion we went through in Arizona. So all in all, we've helped, you know, 3/4 of a million people get coverage where they wouldn't have had coverage before. And we know that people, when they're not covered, they do two things. They delay care, which is all just a waiting game until it blows up, or they go to the emergency room and they don't pay the bill. And both of those things are not good outcomes.
I know at the Hertel report, you study the trends that are happening nationwide as the pandemic continues. There are many unknowns. What's being left out of the conversation when it comes to healthcare?
Well, when it comes to healthcare, I would say it's probably the this uninsured problem. You know, we have a huge part of our society that don't engage in the healthcare system. And then we have a crisis and we wonder why there are these disparities of care. And you can blame a lot of different things for why people don't buy insurance, right? It's too expensive, they just don't believe in it, whatever the reason is. But when a crisis happens like this and we have people that do get sick, we all pay for that. And I think that that's kind of missing from the conversation right now is that if we were better prepared and had more people that had coverage, that when they had that first cough, they went to the doctor or they got telemedicine, and if it was worthy of a visit, they got a visit. And people aren't doing that when they're uninsured. They're not engaging in the healthcare system, so they stay out and out and out, and then it bubbles over, and we all end up paying that bill eventually.
All right, Jim Hammond from the Hertel report. Thank you.
Thank you very much.